Sisary is the Director of the Cambodian School of Prosthetics and Orthotics and the Country Director of Exceed Worldwide-Cambodia. Sisary is actually one of our PhD students in the CDT. She's currently in her third year, and we are incredibly proud of her. I had the pleasure of working with her for 6 months, and she's just an absolutely lovely person. Sis will be joined by her colleague, Dr. Alex Dickinson, who is an associate professor at the University of Southampton. Right, we've got your screen shared, Sisary. Thank you very much.
Thank you very much, Jen. Would you be able to enable my camera? Thank you. Okay. Good afternoon, good evening from Cambodia, or good morning from wherever you are to attend this special event. So the next 30 minutes, we will be talking about the consideration for valuable prosthetic and orthotic research in less resource setting. And particularly, we would like to focus on the lesson learned from the Cambodian limb projects. Next slide, please. So there will be 3 speakers in the next 30 minutes. I will be introducing and providing the overview of the context and background of this project. And then Dr. Alex Dickinson will be talking about the reasons and the overview of the actual project in Cambodia that we are doing together in the last 3 years and a half. And Dr. Cheryl Metcalf will be specifically discuss about the multi-stakeholder value assessment finding from the Cambodian project. Then at the end of the session, I will provide the reflections and conclusion on the findings and lessons learned from our project here. Next slide, please. As you have heard from Kathy as well as other presenters in the last 2 days, P&O dataset and the research in P&O field are kind of significant, of importance, and also of great need, because there's a huge global unmet need for the P&O devices around the world. As you have already heard and got the report from the WHO in 2011, the World Report on Disability estimated approximately 15% of the global population sustain a kind of disability. And from the latest report from the WHO in 2019, estimated that approximately 2.4 billion people worldwide could benefit prominently from a kind of rehabilitation intervention. However, the need has not been met due to an access issue. And when we talk about access issue, it's not only the accessibility to the service, but also probably the accessibility caused by other issues, not only the service itself, but probably the technology or the lack of trained professional to provide services, or the cost that imposed on the service delivery in obtaining the P&O rehabilitation services, or even the coverage based on the geographical inequity of services. So for all of us, researchers, academia, policymakers, service planner, service provider, funders, and investor, we need to support the evidence-based service provision, where we can produce the evidence to decide and to measure the research effort on technology and the service innovation in all the regions, and most importantly, for the people who are in the most needed situation. As Kathy already mentioned about 2030, there's a need for fundamental data set to inform the investment case for prosthetic and orthotic services development and standard. But yet, our effort on the consensus of 2 major issues have not been made yet. What constitutes a good outcome of rehabilitation technology research? We don't know about this. Or what link technology to social impact when it comes to real world setting? I think these are the questions that all of us have to be able to contribute and answer as part of our research interest and also personal interest. Next slide, please. So the need for P&O data research. Why does it need to be done, particularly in less resource setting? And in this context, we are talking about Cambodia with a lot of experience in providing the service from international aided program. We have the services since 1982, and until now, they're actually partially supported by the local government and still majorly supported by the international aid agency. So the data will provide us the evidence that could be systematic and provided us the narrative review to identify the gap and the market research, the industry, as well as the need in the actual setting. We also need the data to develop and transfer new technology to be able to integrate new technology into the real clinical setting and day-to-day operations of services. Data can also have to change the dynamic of service delivery and rehabilitation care. So in this regard, we look at the service planning, the investment plan, the training of professionals, and also the costing, as well as the consortium of effort in improving and maximizing the resources that we are making. And last but not least, I think data is very important for all of us in the research for education. So when we talk about good outcome of rehab technology research, not only for the less resource setting, but globally, and I think for all of us as the academy and people with interest in research, what does it mean to us? So data which justify investment, training, and improving society where people with disability are valued and able to contribute, but at the same time are informed of the result of the technology. What is the latest updates on the technology and on the availability of services and resources that could be beneficial to the people who are the users of technology and the services. Next slide, please. We do not have time to actually show you this video, but if you are interested to see the real life setting of the Cambodian people with disability, I would propose that you go on YouTube and you can visit this. It's about 5 minutes, but if we have some time at the end of the presentation, we will run this video for you. So you will get to see the terrain, the daily activity of living, the standard of living, the resource that we have in the country, where we have to take into account and to the context of our technology development as well as technology integration in our projects. Next slide, please. So what were we trying to do? Because this project already wrapped up on the 30th of November. And the whole cornerstone of our project that we work together with the University of Southampton, Imperial College London, as well as the University of Salford, was actually to assess the appropriateness of technology, new technology, into the less resource setting. And most of the time, when we are the researcher, when we are interested in new technology, and when we are thinking from our professional background as an engineer, as a mechanical engineer, most of the time, we only think about taking the product in the research form to actually say whether the product or the new technology fit or function in another setting. However, in our project, it was not the focus that we did. Our focus was actually whether the new technology and the new product that we brought into the new context improve life of people with disability, improve the positive experience of the people who are using the new technology and the new product. And at the same time, we wanted to measure the impact from the technology and the new product on the social and community setting for the people with disability, as well as the functional outcome measures. And along the line, we also wanted to find out what were the needs and expectations of the local stakeholder, where we are actually have a wide ranging of stakeholders group. So how can we work with them, and how can we involve all of these stakeholders, users, professionals, and also the policymakers onto our projects? So in this regard, we know that in less resource setting, especially in Cambodia, there has been very little evidence and little data on disability data set. And when we gather the data, most of the time, we say that there is no available data for us to analyze. And if there is an availability of data, we have to question ourselves whether the data is usable, the data is reliable, whether the data is accurate, and whether it's transferable to another setting. So those were the components and the fragments around our research project in adding up to all of these three main purpose of the project. So I'll hand over to Dr. Dickinson to talk about the Cambodian project.
Thank you, Sisary. That was a wonderful introduction. Loz mentioned very briefly the Global Challenges Research Funding, which was launched in 2015. And we'd already been doing some work on computer-aided design and computer-aided manufacturing in prosthetic limbs and CAD/CAM. And we were looking at to what extent our research background might apply. And I think we're all familiar with the WHO statistics of the people needing prosthetic and orthotic devices worldwide and access not matching demand. And the particular key reference from Sandra Sexton through ISPO was identifying the specific access barriers of being shortages in personnel training, infrastructure and funding. So we wondered whether there were specific technologies that might help support improvements in service access. When we're talking about technologies, something that I thought I understood at the beginning of our work, but now I understand I didn't understand at all, was this concept of appropriate technologies. And that's especially important given our focus to make sure that whatever we delivered with the project would be sustained. The really important factor here is that appropriate technologies goes beyond simply a device which is sturdy enough for the different kind of environmental conditions that it might see, for example, in the rice paddy field. But it includes concepts of ensuring technologies are environmentally sound, but also sustainable so that they can be serviced or repaired and replaced without dependence on external funding and ongoing support. So we were initially considering whether appropriate CAD/CAM technologies might be useful for developing a workflow to improve access. If we could have community-based 3D scanning of somebody's residual limb, clinic-based design, and maybe a central fabrication model. But thankfully, we made friends with Sisary and Carson Hart and their teams, and we were able to visit and speak to their clinicians and clients to build a clearer understanding of what they needed. We realized that we might be able to deliver a robust CAD/CAM workflow and select the lowest cost-effective technologies, but they still wouldn't necessarily be appropriate technologies. The idea was if we could find a way to fund a carver once through the research project for the computer-aided manufacturing, what would happen when we leave? And we might end up damaging the service that the clinic was currently providing and leave people worse off than before the research project started. So instead, we, again, a theme which Loz identified, we refocused the project, thankfully, early on. And we focused more widely on database technologies to measure and understand service provision. And the idea was that this could both enhance short-term access to services. It could also help Exceed and other non-governmental organizations to evidence the effectiveness of the services that they're providing and therefore be able to sustain them. So the project is a huge story, and I can't tell the whole thing, but we're going to be publishing our full project report very soon, so we'll send that to anybody who's interested. But here are just a very few highlights that match the particular themes that Sisary introduced. So with Maggie Donovan Hall and Chantal Ostler and our local Cambodian man, Ratana San, who was seconded to Exceed from the Cambodian National Institute for Social Affairs, we carried out some very in-depth qualitative interview work with clinicians and the Exceed clients and some of their family members. And we collected evidence around the socioeconomic spiral which can affect people whose prostheses fail and the wider ranging benefits that they offer, and showing how these services might represent very clear social investments. They also told us about the potential benefits and concerns around the use of 3D scanners and activity monitors, which were the technologies we were considering, And they helped us to design the biomechanical engineering work that we talk about very much more safely and with consideration of their specific needs. And we're going to have a paper coming out on this very, very soon. We'll share a preprint as soon as we can, and then hopefully a full peer-reviewed version. I mentioned the 3D scanning. We looked specifically about how that might support community assessment and work out who needs to take the time and expense away from work to travel and visit a clinic, if not yet for a full CAD/CAM design and fabrication infrastructure. And considering low-cost 3D scanning for CAD/CAM, we had already described the accuracy and reliability of some very low-cost scanners, but none of us yet knew how reliable and accurate they needed to be. So we proposed that a critical reliability benchmark was at least as good as the expert clinician. So somebody who gets a really good result, but might just like to get there faster and keep a digital record of their work. So we were advised that UK clinicians might be a little reticent to have their manual plaster practice compared to their workmates. The team in Cambodia have been using 3D scanners in a 3D printing project and wanted to know how reliable and accurate they were. And they were happy to do a study to help us find a benchmark. They didn't feel threatened. So we conducted a crossover study of the reliability of 3 3D scanners shown in these colored boxes with comparison to pairs of plaster casts from the same study group from the hands-on method in black. And we're able to score the scanners relative to the expert human plaster caster. So you can see in some measures, the human is nearly as good as the most expensive scanner you can get. And in other measures, a basic £300 scanner is fairly equivalent to what the human can achieve. Importantly, these data might enable people to choose the right 3D scanning tool for the specific purpose they have, whether it's capturing socket shape for CAD/CAM fabrication or just tracking changes in limb size and shape, or replicating a well-fitting but worn out and damaged socket. We then considered a wider range of community-based measurement technologies. And we undertook a mixed method study comparing objective measures of physical activity, socket fit, and self-reported activity and comfort scores with a questionnaire. And this asked questions about community engagement, the importance of activities to the individual, society perceptions about them and their prosthesis, and their satisfaction with various aspects of the prosthesis, such as the fit and the comfort. We identified weekly patterns of activity and activity levels generally considered to be relatively normal for people without physical disabilities. So the average of what these 20 clients were doing over the course of a week is certainly more steps than I work on a weekday with 2 biological legs. We saw some expected things like participants who were more active wore their prosthesis for longer every day and were more satisfied with socket fit. And often a longer residual limb corresponded with better community participation and comfort. And reassuringly, the person's self-reported activity seemed to correlate well with objective measures of step counting. But we uncovered some complexities in the situation supported by qualitative work. So activity patterns didn't seem to correspond just with the level of work, although this was highly variable. Other activities which the individuals ranked as important in terms of community participation didn't correspond with how active a person was or how comfortable the prosthesis was. So in short, just because you walk more steps per day doesn't necessarily imply that you're a certain amount happier. As well as this, a simple 0 to 10 scale of comfort didn't provide enough detail to understand the types and severity of discomfort which they experienced, as all people reported high overall comfort, but high discomfort scores on individual measures, such as aches and tenderness and rubbing. So again, this shows that we can probably trust the digital technologies we have at our disposal, but the simple objective measures don't necessarily tell us the whole story, especially with regard to what individuals find important. And we have just this morning submitted the preprint for this paper, and then we're submitting it for peer review. So I'll share the link to that if anybody was interested. A final and crucial work package in the project involved considerations of sustainability and understanding the value provided by prosthetics and orthotic services in Cambodia, and the full range of stakeholders involved. And I'm going to hand over to Cheryl to cover this.
Thanks, Alex. So taking a slightly broader view across the ecosystem of stakeholders that exist across Cambodia. Now, this is a stakeholder map that we generated with the help of colleagues in Cambodia. It's not supposed to be read, it's supposed to illustrate the complexity of the landscape in which any P&O service will sit nationally. We have a version of this for the UK as well, if anyone's interested. And the different coloured lines denote different organisations that we would need to interface with to be able to ensure that everything was, that technologies are developed that are fit for purpose, as Loz has said, and as Alex has just illustrated in terms of the use of those technologies. And we're quite used to, as a field of P&O, understanding that technology should be user-led to make them usable. But what we don't do very often as researchers actually is to look at the landscape in which that research fits in the longer term. And so this is what this work package focused on. It was identifying who our stakeholders were, having discussions with them across everybody from ministry to community health workers, and trying to get a broad view of some of the barriers and opportunities for integrating some of the data technologies that we were looking at in the Cambodian project. Next slide, please, Alex. So we developed an engagement methodology, consolidating a lot of known tools from across different sectors, from stakeholder engagement to business modelling and analysis to qualitative research, and consolidate them into this engagement methodology. We developed interview guidelines for each stakeholder segment, so each group. So we would talk to high-level stakeholders. We had a tailored interview guide for those people. Equally, we would have a different interview guide for the clinicians and other stakeholder groups. We took a variety of meetings. We had translators in some of those meetings, and notes were taken by two team members, Chantal Osler and Alex, during those discussions. After the interviews took place, the meetings took place, the translators, a member of the Exceed team, Alex and Chantal, would sit and have a bit of a download, a reflective session after each meeting to get not just what was said, but the cultural and social implications of what was said, and political considerations as well if they were high-level stakeholders. This has been crucial, first engaging with those stakeholders to understand those barriers and opportunities, but also understanding that in order for this research to be sustainable, that people have to know it exists and see the value in it. And some of those stakeholders can act as advocates for the project as the project develops and goes on. And it's very important to do this from day one, and it evolves throughout the project as the technology and the technological solutions develop throughout the project as well. Next slide, please, Alex. So these fieldwork notes were analysed, and we did some iterative analysis, identifying recurring motifs, and that is the coloured segments on this map. And these motifs represent themes across the different stakeholder groups. And we have visualised this in this new, what we're calling a BAO motif map, and it's Barriers and Opportunities motif map. Next slide, please, Alex. So I'm going to take you on a whistle-stop tour around the barriers and the opportunities. So the first barrier that we identified was access to services. So following a new amputation, many people face lengthy delays before they're fitted with a prosthesis, and that's primarily due to the absence of widespread referral systems after you've had your surgery, and a lack of awareness that those systems exist. The cost of attending P&O services was also thought to be prohibitive for many patients, especially those from more rural areas. The monetary impact of travelling to and from the centre, the accommodation costs while the limbs were manufactured, and the time away from family and earning potential could lead to a significant financial burden for the patient. Next slide, please, Alex. The next one, culture of disability. So people with an amputation were often described as the poorest people in their communities, and these aspects of socioeconomic status and perhaps social stigma were viewed as linked to poor health and poor health-seeking behaviours. Next slide, please, Alex. Healthcare workforce. So small numbers of prosthetists, orthotists and physiotherapists in Cambodia, and there are many unfilled training places. low wages as well in PNO and physio can lead to a pull to the private sectors, especially for the physiotherapists. And the private sector can also be used to supplement wages. So people are doing both jobs at the same time, but this is not an option for prosthetists who have even lower wages and are not awarded civil servant status. And this is because the PNO service originates in the Ministry of Social Affairs rather than in the Ministry of Health in Cambodia. Next slide, please, Alex. So the next one, the prosthetics and orthotic services were seen as a barrier and an opportunity. And this is denoted by the two different colours on the wheel. So we establish, there's a well-established network of physical rehabilitation centres across Cambodia, working in partnership to deliver services. And however, the stakeholders felt that there was significant variation in the service setup, the staffing, the budget and the focus, and that had an impact on the quality of access and the service quality. Next slide, please, Alex. The government role. So this was the World Health Organization Rehab 2030 strategy highlights that the need for rehabilitation services to be aligned with the wider healthcare systems and be governed by the country's Ministry of Health. However, as I've just said, in Cambodia, physical rehabilitation centres fall under the Ministry of Social Affairs, Veterans and Youth, and it's seen as a social intervention, and therefore cannot directly be linked to the aims of universal healthcare. However, there's been shown a drive for collaboration and new investment in a national centre for health and rehabilitation. Next slide, please, Alex. Another barrier and opportunity was around dependence on the prosthesis. So stories that were told to us by limb wearers described how the prosthesis has enabled their return to employment and engagement with their community. And this reflects very much the information that's come out more recently in the prosthetics overview from the GDI Hub and AT scale. However, because of this dependency, any threat to limb wearing, for example, breakages, would have a major impact on the way that people were able to live their life and participate and do the things that are meaningful to them. Next slide, please, Alex. A great opportunity in Cambodia was thought to be the orthopedic component factory, which was handed over to the Ministry of Social Affairs, Veterans and Youth from ICRC in 2018. And it's seen as an opportunity to generate income within the country and through regional export, as well as the opportunity to develop new products and manufacturing techniques of prosthetic devices and wider assistive technology that meets the social and cultural needs of the people in Cambodia. Next slide, please, Alex. And the final opportunity was thought to be persons with disability as role models. So persons with disability were involved in the meetings, spoke to us about breaking the stigma of disability and supporting and advocating for their peers and becoming role models for independence and empowerment. As a group, they are really important stakeholders to involve because they were both highly interested and influential amongst their peers and increasingly involved at a government policy level. So at this point, I'm going to hand back to Sisary, who will be able to talk about a reflection on the Cambodia project.
Thank you, Alex and Cheryl. So just for the reflection for this project, as the project was able to work with the 3 physical adaptation centers, which are supported by EXIT worldwide in Cambodia, as well as our community-based adaptation program in all of these 3 centers, plus the Cambodian School of Prosthetics and Orthotics, where we are training associate prosthetists and orthotists from 26 different countries. So this is a list of reflection from the project, more like the lesson learned that we have gained from the project. First of all, expectation and expectation management and communication between stakeholders and partners in the project were very important. I think the project was score as a very successful project because we have demonstrated a mutually beneficial partnership and also mutually respectful and a very well balanced integration between academics and clinical expertise. And at the same time, the project has been able to contribute and build on the local expertise rather than enforcing the expertise internationally and brought into the country. And at the same time, the experience of the local practitioner and clinician have been well used and also have been built up on the project's foundation and the project aim. And for this project, we took the project as people-centered approach rather than technology-driven research. Even the whole idea and the whole initiative was actually to assess the appropriateness of a new technology. However, everything that we did was around our users, our clinicians, our stakeholders, and the people who we were working with. Similarly, to what Loss was saying about the Fit for Purpose project, we were concerning on the knowledge and skill transfer. When we are talking about technology research, we talk about the research that would fit into the context that would be beneficial to the people when they are able to feel that the project can add on to their current knowledge and current skill. And the essence of the local stakeholders and players in the sector, such as government and development partner, as well as disabled person organization, were taken into account. And from that, we were able to disseminate the information and also the technology on the project to a wider range of stakeholders. At the same time, when we started the project, when we did the project planning, it was the process of what we call participatory planning action. And also during the process of the implementation of the project, we were able to reflect and monitor and evaluate the project together from both our partner in the UK, such as Southampton, University of Salford, and Imperial College London, as well as Exit Worldwide staff, the management team, as well as the researcher team. Access to the appropriate local stakeholders and contact were kind of significant to this project. We were very fortunate to have the access through Exit Worldwide in Cambodia, list of contact on the stakeholder map that Cheryl showed a little bit early on. And at the same time, this project was tackled between 4 different work packages. It was like the multiple aspects of the disability intervention, as well as prosthetic and orthotic and rehabilitation services in Cambodia in one package. So in every visit, in every discussion, in every meeting, we were talking about 4 different packages that encompass the work that we were doing in the project. At the same time, also the compliance with the local ethic and local context were part of the success of this project. I have only 2 more slides. The next slide is talking about the Cambodian barrier and opportunity. Slide. So when Cheryl was talking about this barrier and opportunity map for the Cambodian stakeholder, Exit Worldwide, ourselves and myself, we perceive those barriers as the opportunity, and we see those current opportunity as the opportunity that we have to work together for innovative solution. And at the same time, this map is very important because it gives us an overview of both macro environment and internal capacity and limitation of our partner in the local context. Next slide, please. Last one. So in conclusion, I want to provide a summary to this. What we think we can take it as a take home messages from the project that we have done in the last 3.5 years is the collaboration. We cannot be successful without collaboration, and collaboration requires participation from an interdisciplinary team. As you could see in the project, we have physiotherapists, we have people from the socio-economic background, engineer, prosthetics and orthotics, and other people like Maggie into the team. And we talk about innovative solution. I think when we sound out a new idea, the idea can be a very stupid idea, but it can be very innovative for the context that we are working in. And whatever we are doing, when we bring a new technology, a new research, a new product, it should be responding to the need of the local demand and context. It's not about our own interest as researchers. And at the same time, the most important thing in the project that we would value is actually ensuring that the project is meaningful to the local partners and users. Because whatever we are doing is to improve the quality of life and maximizing the positive experience of our users. And we have to address our approach as a cross-sectoral approach to ensure that we work on the wider service inequity in the sector. And the next item is to develop the local practitioner and engaging the client into our project so that we promote the ownership and also we promote the inclusion of people with disability. As I say, nothing about us without us and leave no one behind. So the project has been very successful. We know there's still lots of more work to do, and if any of you would like to know more about the project, please feel free to contact us. And we hope to actually host your research interest or any project that you would like to carry out in clinical trial or testing your prototype in Cambodia. So please feel free to contact me or our team in Cambodia. Thank you for your attention.
Thank you very much for that, Sisary. Apologies, I didn't get to introduce you, Cheryl. Cheryl is a Principal Enterprise Fellow at the University of Southampton. Thank you for joining us. We do have one question. We are a little bit over on time, but we've got a break scheduled in until 1:15. So for the people watching, if you want to pop off and go and get a brew, that is absolutely fine. But we've had a really lovely question come through, so I'll ask it anyway. So this is from John. And they say, thank you for sharing your work, Sisary, Alex and Cheryl, very interesting. Do you already have ideas of where you would like this project to go once you finish your PhD?
Thank you, John. I think it's a very important question. Actually, my PhD research project is on the rehabilitation sustainability, looking at the financing sustainability for P&O service in Cambodia. And all of this is not only purely from the current work that I have been involved with this LIM project or the Exit Worldwide project, but also I think it's the personal interest to see the P&O profession continue to provide service for the people who are in need of Cambodia. And currently, the international aid is training for the Cambodia LIM project. I mean, prosthetic and orthotic services in Cambodia. Then they rely on the national budget, and government funding is very, I think it's very fragile, I could say, as we have experienced the handover of 5 physical rehabilitation center out of 11 from the international agency to the local government. And even this morning, I attended the ASEAN victim assistance consultative workshop, and the issue is very prominent. All of those 5, I could say that all of those 5 physical rehabilitation center which are handed over to the government is at almost like 0 level service. And all the international investment which we have made in the last 20 or more like 30 years has been wasted through this. So for me as a clinician, I'm a PO by background, as a clinician, as a local practitioner, but also as a local partner for the development of P&O service and rehabilitation professional in Cambodia, I believe that relying on only one model of funding is not sustainable. So if there is no money from international aid, and we are saying the government has to take over fully, everything will collapse. And the victim of this significant change and issue will be our users, will be our people with disability. So my PhD is looking at the different alternative model for rehabilitation financing for sustainability in P&O service in Cambodia. Thank you, John.
Yes, thank you very much, John. And thank you, Sisary, for answering that question. Gosh, you certainly do have a lot on your plate. Just because of time, we are going to have to head to a break now, but thank you very much for your talks on this session. So that's for Loz, for Kathy, Sisary, and Alex and Cheryl. Thank you very much. So we will now be on break until 1:15, at which point we will move over to our poster session on spatial chat, where I think most of the authors should be in place next to their poster or presentation to talk a little bit more one-on-one if you have any questions about their project. We have a poster competition open for People's Choice. We also have a prize for the best abstract that was submitted overall and the best student submission. But as I say, the survey is up at the moment where you can vote for your favourite poster. Voting closes at 2 o'clock, so please get your votes in before then. And the awards will be given out at 2:30, where we'll be joining back together on the website for the final address from our co-host Sean, and to close our first conference. Thank you very much, and I'll see you on Spatial Chat.